Is your liver dying? Many of us don't know, but our liver's slowly dying due to fat accumulation. Fatty liver has affected approximately 25 to 30% of adults only in the United States. According to the World Health Organization, it is a leading cause of liver transplantation and contributes to over 2 million deaths annually. Recognizing its early signs and symptoms can help in its prevention and easy reversal. In this video, we will talk about early signs that most people do not notice, the major symptoms of having a fatty liver, causes of fatty liver, how fatty liver affects other crucial systems of the body, and what food intakes help in reversing fatty liver. But before discussing its major causes and symptoms, let's first talk about what is fatty liver. Fatty liver, also known as hepatic steatosis, is a condition characterized by the accumulation of fat within liver cells. Normally, the liver contains some fat, but when the amount of fat exceeds 5 to 10% of the liver's weight, it is considered fatty liver disease. Fatty liver can be classified into two main types: non-alcoholic fatty liver disease, alcoholic fatty liver disease. Fatty liver may not cause noticeable symptoms in its early stages, but as the condition progresses, individuals may experience noticeable signs in the overall body. But the good news is that the liver has the ability to heal itself if taken care of properly during its early diagnosis. So, let's explore the earliest signs of fatty liver through which we can make a timely diagnosis. 1. Fatigue. Even after adequate rest, feeling tired or fatigued can be an indication of fatty liver, as the liver is struggling to function correctly. 2. Stomach pain and heartburn. People with hepatic steatosis aka fatty liver often experience dyspeptic symptoms like heartburn and a feeling of fullness. 3. Excess gas. Accumulation of fat in the liver can lead to excessive gas, hindering the visualization of organs in exams. 4. Loss of appetite. Some people with fatty livers may feel a reduced desire to eat or even a sense of fullness without eating much. 5. Pain on the right side of the abdomen. Discomfort near the ribs or a nagging pain under the rib can occur due to liver enlargement. 6. Increased thirst. Feeling thirsty or the urge to drink more water than usual could be an indication of fatty liver. 7. Dark urine. Urine darker than normal, with a stronger smell, may indicate liver disease, such as fatty liver. 8. Nausea. Excessive fat in the liver can result in liver inflammation, which brings abdominal discomfort or pain accompanied by nausea. Now let's discuss the major symptoms of fatty liver, which might not be visible in the early stages of fatty liver. 1. Jaundice. Jaundice is a significant symptom of a fatty liver. It occurs when there is an excessive buildup of bilirubin, a yellow pigment produced during the breakdown of red blood cells in the bloodstream. In a healthy liver, bilirubin is efficiently processed and excreted. However, when the liver is compromised by fat accumulation, its ability to process bilirubin is impaired, leading to its accumulation in the body. This buildup causes yellowing of the skin, eyes, and mucous membranes, giving rise to the characteristic symptom of jaundice. 2. Spider veins. Spider veins, also known as telangiectasias, are small dilated blood vessels that appear close to the surface of the skin. They often form a web-like network of red, blue, or purple lines, hence the name spider veins. These veins are commonly found on the face, legs, and feet, and may indicate an underlying liver condition. When the liver is damaged, estrogen levels are elevated, which can result in increased pressure in the veins, causing them to become visible. Spider veins can also be a sign of other liver conditions such as cirrhosis or hepatitis. 3. Cracked heels. Cracked heels can be a sign of a damaged liver. Our body uses vitamin B3, also known as niacin, to keep our skin moisturized, smooth, and strong in order to protect it from damage. However, when our liver is damaged, it uses up all the stored vitamin B3 in an attempt to repair itself. This deficiency of vitamin B3 leads to cracking of the feet, heels, and foot soles. Do not ignore this small sign as it could indicate a damaged liver. 4. Itching all over the body. Itching all over the body is often associated with fatty liver disease. Please note that severe itching, also known as pruritus, can occur due to impaired liver function. Fatty liver disease may progress to liver inflammation and scarring, cirrhosis, which can affect bile flow and lead to a buildup of bile salts in the bloodstream, contributing to itching. If you're experiencing persistent itching all over your body, It's essential to consult with a healthcare professional for proper evaluation and diagnosis. 5. Pale stool. Pale stool can be another sign of liver damage. When we eat food, our liver produces bile to digest foods and fats in it. This gives the stool its normal brown color. But when you have a damaged or fatty liver, it can hinder the flow of bile through the bile ducts. This changes the color of the stool, making it lighter, paler, or clay-colored due to the indigestion of fats. Your stools can become buoyant, causing them to float on the surface of toilet water. So, do not ignore these signs and consult a medical professional as soon as possible. 6. Swollen right foot. Liver damage can lead to a condition called peripheral edema, which is the swelling of tissues, usually in the legs and feet. When the liver is damaged, it may fail to produce enough albumin, a protein responsible for maintaining fluid balance in the body. This imbalance can cause fluid to accumulate in the lower extremities, leading to swollen feet, particularly on the right side due to the way blood flows through the body. 7. White or yellow bumps around the eyelids. Another weird sign of liver damage is when you start seeing white or yellowish growths around your eyelids. These little packets or bumps around the eyelids are cholesterol deposits known as xanthelasma. When someone has a liver condition, the liver stops breaking down cholesterol. Instead, it starts building up in different parts of the body, including the eyelids. Xanthelasma could be a sign of liver disease, so please don't ignore it and have a liver checkup as soon as possible. 8. 5 right-sided pressures. Another noteworthy sign indicating potential liver disease is the sensation of pressure or discomfort on the right side of the rib cage, especially after eating. Basically, the bile produced by your liver becomes thick and sludgy due to liver damage, which then blocks the small ducts connecting to your gallbladder. This sludge buildup puts pressure on your ribs and can even affect your phrenic nerve, causing muscle tightness and discomfort in your right shoulder. It's important to recognize these sensations as possible signs of liver problems so that you can seek help before it's too late. 9. White or swollen nails. White nails. White nails, also known as leukonychia, can be a sign of liver problems like cirrhosis or hepatitis. This change in nail color occurs due to changes in blood composition and circulation, often associated with liver diseases. A study conducted in the 1950s revealed that 8 out of 10 individuals with severe liver scarring had completely white nails, demonstrating a strong correlation between nail appearance and liver health. Clubbed nails, characterized by round and enlarged fingertips, may also be a sign of chronic hypoxia, often associated with liver diseases such as cirrhosis. 10. Night blindness or nyctalopia. Poor night vision or nyctalopia can be another sign of damaged liver. It is a condition where an individual has difficulty seeing in low light or darkness. As we know, the liver's duty is to filter toxins and produce proteins, including one called retinol-binding protein that transports vitamin A to the retina. When the liver is damaged, it can lead to a deficiency of vitamin A, which affects the cells and the retina responsible for low-light vision. If experiencing poor night vision, it is important to see a doctor as it may indicate liver damage. If you have any of these symptoms that we have mentioned above, you might want to visit your doctor and get your liver examined via an ultrasound test to see if you have a damaged liver. Now, let's talk about the causes of fatty liver or who is more likely to have fatty liver. Let's explore the risk factors. 1. Obesity. Excess fat accumulation in the liver is common in individuals with obesity, leading to liver inflammation and potential scarring over time. 2. Type 2 diabetes. Insulin resistance associated with type 2 diabetes contributes to abnormal fat accumulation in the liver, exacerbating liver inflammation. 3. High blood pressure. Hypertension can contribute to fat accumulation in the liver, especially when coupled with other risk factors like obesity and insulin resistance. 4. Excessive alcohol consumption. Metabolism of alcohol in the liver can lead to oxidative stress and inflammation, causing fat accumulation and potentially severe liver conditions. 5. Zero physical activity. Lack of physical activity contributes to fat accumulation in the body and liver, often coexisting with obesity and insulin resistance. How can we reverse liver damage? Liver damage occurs in 4 stages. At first, excess fat builds up in the liver cells, leading to inflammation and the development of scar tissue called fibrosis. If not stopped at this stage, It can lead to permanent scarring of the liver, also known as cirrhosis, which is the most dangerous stage and results in liver failure. Fortunately, the liver has the ability to completely heal and regenerate itself with proper diet and other remedies. 1. Start drinking organic coffee. In the morning, instead of adding sugar, add half a teaspoon of turmeric to your organic coffee. The phytonutrients in turmeric and polyphenols in coffee help reduce scar tissue formation and repair damage caused by drugs, alcohol, and fructose. 2. Drink plenty of water. Drinking at least 1 liter of water daily can help thin out the blood and aid the liver in producing bile to break down fatty deposits. 3. Incorporate liver-cleansing herbs and spices. Incorporate as many liver-cleansing herbs and spices into your diet as possible, such as ginger, turmeric, cinnamon, dandelion root, milk thistle, reishi mushrooms, green tea, and cloves. 4. Eliminate inflammatory seed oils. Eliminate inflammatory seed oils from your diet, including corn, cottonseed, canola, rapeseed, soy oil, margarine, and low-quality processed olive oil. Replace them with anti-inflammatory fats like butter, tallow, extra virgin olive oil, and coconut oil in your home-cooked meals. 5. Incorporate sulfur-rich foods. Incorporate sulfur-rich foods into your diet, such as leafy greens, arugula, radishes, garlic, broccoli, Brussels sprouts, kale, cabbage, mushrooms, pasteurized eggs, oily fish, walnuts, onions, scallions, and broccoli sprouts. 6. Stop eating processed and sugary foods. Cut back on sugary, starchy, and flour-based foods such as bread, biscuits, sweets, ketchup, pancakes, pasta, soda drinks, etc. A fatty or damaged liver is sensitive to fructose, so it's important to stop drinking fruit juices and alcohol entirely. 7. Take purified bile supplements. To lower inflammation and cleanse fatty deposits inside the liver, you can take purified bile supplements. These supplements are particularly effective when taken in the morning on an empty stomach and can eliminate fat from the liver and prevent the formation of gallstones. 8. Try intermittent fasting. Intermittent fasting is a great way to give your liver a break and keep it healthy. It helps reduce liver fat, improve insulin sensitivity, and lower inflammation. Plus, it triggers a cleansing process that gets rid of bad stuff in your liver. By following these steps and making dietary adjustments, you can support liver health and potentially reverse fatty liver disease. To learn more about fatty liver and how to protect your liver, subscribe our channel.